Welcome to the Infidelity Doctor channel. My name is Dr. Talal Al-Salim, and this is the Ask Dr. Talal segment, your place to ask me anything you want to know about affair recovery and affair prevention. Please remember, this is not a substitute for the counseling that you're supposed to be getting. This is merely a place for you to get some basic question answered and a place for you to learn about my clinical insights when it comes to affair recovery and affair prevention. So before we get to the question of the week, make sure that you like the video and subscribe to the channel so that you can get the most recent updates. So the question of the week is as follows. What do you do when you're triggered by a TV show? Unfortunately, nowadays, it doesn't matter what TV show you're watching or what radio station that you're listening to, there's always going to be some kind of reference about infidelity or affairs because it is a common and prevalent issue. So you're bound to run into it at any point of time. We also need to think about infidelity as a traumatic event, and when people are exposed to trauma, they're going to experience PTSD symptoms. Some of those symptoms will entail having triggers, having flashbacks, recurrent nightmares, and trauma manifests differently for each person. So a common mistake people make when they have triggers, especially the betrayed, they try to suppress those triggers. Why do they do that? Sometimes it's uncomfortable for them to experience, and sometimes they worry that if they continue to be triggered, then the unfaithful is going to be frustrated with them or think that they're not getting better. And this is what I always remind people: just because you're having triggered doesn't mean you're not getting better. It means that this is part of the healing process. How you handle the triggers is going to determine the frequency and intensity in the future. Another common mistake people do when it comes to triggers is they try to overexpose themselves to triggers, going out of their way to desensitize themselves. Why does this happen? Sometimes it's really motivated by the betrayed feeling that I don't want to feel this way, and maybe if I overexpose myself to triggers, maybe I'll become desensitized. Sometimes it's really a pressure from the unfaithful who is not being mindful of the readiness of the betrayed to get to resume normal life or normal life activities. So when somebody is dealing with triggers, my policy on that one is that you really need to find the balance between not suppressing those triggers, but also not overexposing yourself to them, because you really want to allow yourself natural exposure to those triggers so that you don't overwhelm yourself. Another question that usually comes up when it comes to triggers is the betrayed worry whether or not that when they have a trigger they should handle it on their own and keep it to themselves. So we're going back to that question of what do you do if you're watching TV with your partner and something happened in the show that bring up the issue of infidelity. Again, suppressing it would not be a good idea because your partner is going to know that something is going on. You're more than welcome to try to process it on your own, but if you're not able to process it on your own successfully as the betrayed, you need to tap in the unfaithful partner so that they can help you. You're not feeling that you're alone in dealing with this trigger. But even if you manage to process it internally, I think it's still important for you to share that moment with the unfaithful. Again, the hesitation here, if I share it, doesn't mean that I'm hanging on to it or we're not getting better. No, that's not really the case. This is just really more of an opportunity to show your partner that, yes, this is a process and you don't have to be alone in handling that trigger. So don't ignore it. Don't pretend it didn't happen. Take some time to process it, whether internally or with your partner. Another mistake that happens when people allow themselves to process the trigger, oftentimes the betrayed start bringing up the story of the infidelity. They tell the unfaithful, tell me again why you did this, or tell me again this part of the story. So they end up revisiting the story of the infidelity, and that tends to cause people to avoid dealing with triggers in general, right? Because they don't want to have to revisit the story. So the best way to handle trigger is to keep it focused on the present. So if you're the betrayed and having a trigger, if you already know the story about the infidelity, Re-asking about something that you already know the answer for is not going to help you in that trigger. In that moment of time when you have the trigger, what you're really looking for is reassurance and a sense of security. And the best way to get that by articulating that to your partner, letting them know what you need to hear from them in that moment of time in the present. Because if you try to deal with your trigger by revising the past, nothing's going to come out of it. That event already happened. So you need to be really focused on the present of what can your partner do for you at this moment of time in the present time to help you with this trigger. And oftentimes it's, like I said, really more about asking for reassurance and security. And sometimes it's that, an apology again, that I'm sorry that I did this to you, and reassurance that I'm going to be working really hard on not failing you and doing everything that I can to rebuild trust. And it's going to be different for each person. So sometimes the betrayed doesn't really know what they need when they're having a trigger, and that's okay. But maybe you can ask your partner to help you process, to figure out what can they come up with to help you with that triggers, other than revisiting the past and revisiting the narrative of the infidelity. This is assuming that this was actually done properly. So hopefully that answered the question of the week. Feel free to leave your comments in the comment section below, and any questions that you'd like to see me answer in future videos. Until then, be safe, be well, and embrace the possibility for a brighter future. Take care.